So welcome to Benefits of Assisted Living, knowing your options and make a plan. So I want to welcome you. My name is Shelly Henderson. A lot of you I know. I have been here, this is my 11th year. I'm the Senior Director of Sales for both Berkeley Square and Westover. And really, why do you care about that? I help people learn about living here. At the end of the day, hopefully at the end of our half hour, you call me. And that's really where this story begins. It's about everyone listening on this call. But hopefully today, our goal, Miranda and I, is to let you know a whole lot of information about assisted living options, COVID, all those great questions. So we're excited. I'm excited. Zoom is, everybody's got to put their lipstick on for Zoom. So anyway, my name is Shelly and I want to welcome all of you. And I'll introduce Miranda, who's our Assistant Vice President of Health Services. She'll join me today.
And hi, everyone.
Kelly,
I have to.
Oh, sorry. I was just going to say Kelly is unfortunately unable to be here due to a medical issue. So Miranda is going to handle all the clinical content for us.
Mm-hmm. Hi, everyone. I have to disclose that this is the first time I've worn lipstick in months. So I'm really excited, probably overly excited. But my name's Miranda Sichenoff. My title is the Assistant Vice President of Health Services here with Community First Solutions. What that means is I'm a licensed nursing home administrator, and I am the administrator of Berkeley Square. And I also help with our other two communities as well.
Awesome. I'm excited. So I hope all of you have a coffee, buckle up. We're going to have some slides that you'll be able to follow, but it really is a chat really between, I was going to just ask Miranda some questions, but I will start really by introducing assisted living. A lot of people ask me, what is exactly assisted living? So to be honest, it looks different for every single person. When I meet with families, sometimes they're noticing mom's not eating, nutrition. Sometimes it looks like memory loss. They're forgetting to take their meds. Maybe it's showering. Maybe they are just, we call them activities of daily life. It's that moment in time where either you're noticing this about a loved one or you yourself are starting to forget things. What does it include? It's daily support. At the end of the day, it's apartment life with some support. I will tell you, assisted living, as I said, looks different for everyone. We have people that we help with snaps and buttons, and we have people that we're doing queuing for. Hey, it's time for breakfast. Hey, it's time for lunch. There's no crystal ball. There's no miracle day that something just pops up that says, oh, today's the day I know my mom needs assisted living, or I know I could use that kind of support. But that's what we're for. That's what Miranda, our nursing team, myself, we will help guide you as you start to see really those moments of when you might be needing some support. I will tell you a benefit of assisted living is not being so isolated. My own experience, I can share with you all. My grandfather, he was fiercely independent, but let me tell you about socialization. He loved to see people, and we know through COVID, like life is meant to be lived together. So just seeing a friendly face, having lunch with someone. I know a lot of our residents, they miss that a lot right now during COVID, but the social side of what assisted living provides, it really is the heartbeat of it. It is, yes, about care, but it's also about socialization and engagement. I will tell you, if I were a daughter, some things I would want to know is another benefit is really the health component. Someone consistently monitoring our nursing team, how we're doing. Are they eating? Are they taking their meds? That health record, you don't, as a daughter, you don't have to feel like the weight of the world as a caregiver is on you. let our professional team have that clinical healthcare component. We become your family that way. We are your healthcare partner at Berkeley Square in Westover. And I just think that's for me, a very, very big part of it. And I say this to families all the time. You get to become family again. We become the caregiver, where I see people. I met with a lady last night at her home that said, I'm 70 years old. I can't help mom with the shower much right now. Well, of course you can. That's what we're for. She'll get to visit again. And when we, obviously open back up, that will be a big part of it. So I will kind of switch over and talk about clinical expertise at Berkeley Square. We are, if I didn't mention, we are a continuous care community. And there are people on this call who know us and love us, and there are people who have no idea that might be watching. What is a continuous care community, Miss Miranda?
Well, a continuous care community is a life plan community, and we have all levels of care from independent living, assisted living, skilled nursing, memory care. And obviously what we're talking about today is assisted living. But our assisted living folks, they have the benefit of having healthcare and skilled nursing under the same roof. And so, what that means for you is that we are not a freestanding assisted living. And so we have RN manager coverage 24/7 round the clock. Who is available and will assess you for any of your healthcare needs, which is completely rare. Most other assisted living facilities have RN on call. They don't actually have an RN on duty, and we do. Also, at night, other facilities have only an LPN on call perhaps, and they just have aides, caregivers. And so we have an LPN round the clock designated to our assisted living units.
That's perfect. And as your cruise director on this Zoom call, if you're writing things down, what she said, what makes us different than anywhere else is having an RN on site. Believe me, I have worked for places that say, oh, yes, we have care. Guess what you're going to see? There is a nurse in her bed and an aide that picks up the phone if they need assistance and calls. On-call nursing is very different than Miranda and our Berkeley leaders intentionally deciding we will continue to operate with an RN on site to oversee assisted living. Huge difference in many of those other, let's face it, people can go anywhere for assisted living. That is one of the biggest differences I would care about if I were watching as a daughter.
And Shelly, we are also a 5-star community. And what that means is that we are completely dedicated to quality. And there are only a small amount of communities in the nation who are able to be designated 5-star because there are a limited amount of spots for that. And it is a designation that we are constantly working at every quarter. Our information is reviewed and, our outcomes are reviewed. And so, we are always working to maintain our 5-star, and we actually have in our communities during this pandemic. So I'm really proud about that.
That's a good point. I also wanted to bring up, Miranda, so if my mom, I love more than anything in the world, and I'm trusting you with her, the everyday caregiver. Can you talk about their qualifications and really how that stacks up to everyone else in the world in Butler County?
Sure. We actually, we intentionally have decided to make sure that all of our caregivers are state tested nursing assistants. And that is rare. So we actually have a nurse aide training program. And so we invest in our new employees and our aides, and we have them go through the course. It's a 2-week course, and they have to take a test. And so then they are in a state database as someone who is qualified and certified to provide care as a state tested nursing assistant.
Super. That's another write it down moment, family watching. Write it down. Caregivers with us go through a qualification process that is like a nurse would do, a certification So it's not just, and again, I have worked places. The caregiver is someone that gets hired, and guess who trains her? Just somebody. They're not going through the training that we intentionally have dedicated our business to, really making that commitment to families. Perfect. Next slide. I love this. All right. So remember, we're just friends on this call. It's the elephant in the room. You know what I'm going to say. COVID-19. So we are going to address some surface things about COVID-19, but we can't do this call without talking about that. So we're going to talk about, Miranda and I, and I'm sorry, this is just the forum we set up. It's just a casual chat between she and I, but we want to walk you through what are we doing to protect our residents in this building throughout every 100-year pandemic. Miranda.
All right. Oh, sorry.
You want to talk about, so regulatory compliance as a family, they all want to know, how do you know what to do? Let's be real. How do you know how to protect my mom in assisted living?
Well, I actually have been with this company for 5 years, and I have been a nursing home administrator since I was 22 years old. So I've been doing this for almost 20 years as an administrator. So call me crazy, but I love it. I love it, every minute of it. And so this pandemic has definitely tested my skills, and it's tested our entire team skills. But I am proud to say that we have done a great job, and I don't say that lightly. As an administrator, I have to take, a test and several tests, and I am licensed, so I have guidelines from that aspect. Skilled nursing is the second most regulated industry in the world, and so we're second to nuclear power. So, yeah, and I kid you not. You could Google that.
That's true.
Yes. But anyways, I won't bore you with all of the different regulatory bodies, but we have mandates from the federal government, which is CMS. We have mandates from the CDC, which I'm sure you're all aware of, who the CDC is for infection control. And we also have mandates from the Ohio Department of Health. And I'm sure you've heard Governor Mike DeWine, he gives his regular press conferences. And so he is continuously giving us different guidelines that we have to flex. And I have to just review all of those new policies and things of that nature. But anyway, we've had successful, multiple surveys at our communities through the pandemic, and we've done excellent. I mean, perfect surveys on most of them. I believe we had one minor thing at one of the other buildings, but it was, nothing to be worried about. We've been maintaining our 5-star ratings during all of this, and we work closely with the local health departments. I was really, really proud of our whole team, because the health department and the Ohio Department of Health, through different experiences, they have shared our policies and procedures as a best practice for other providers. And so I just am so proud of our whole team for that. We have an infection preventionist position, which is completely voluntary. So we have chosen to invest in that position. It's a registered nurse. And she's been with the company for many years. Her name is Wendy Brown, and her sole job is just to look at infection prevention. So she has led our team, which has been multidisciplinary.
Super. So for those of you that don't speak administrator, Ohio Department of Health, the CDC, the CMS, those guidelines all come to Miranda and the team to make sure that we're following that.
Mm-hmm.
So you give over 1,000 tests. Is that about what you're running right now for COVID every week?
Oh, yeah. Yes. Yep. Twice a week.
Are you testing residents and staff?
Yes, we test residents and staff twice a week, because we want to make sure that we are ahead of the game, because we want to reopen and we want to reconnect people and all of that. So we always are just monitoring that, because we know that if one slips through the cracks, it can just devastate people.
Sure.
In any of our progress. So
Sure. So for people watching, that's a write it down moment. She has intentionally dedicated a position to infection control. And this position, Wendy Brown, has made it now where our buildings are the model. The health department has used us, Berkeley and Westover, as the model of how to operate your buildings. That's huge as a daughter. That's huge to me.
I think
I know you're a
I'm going to
germaphobe.
chime in because I just want to say, one of the things from an organization perspective, in February of last year, our CEO called all of us together and said, it was, I think, before we ever had a COVID case in the United States, and
Mhm.
said, let's get started. Let's get maintenance, housekeeping, dining, all of these teams together and start planning for what if. And I know, we thought, oh, this guy's crazy. And we thought, oh, but it'll be good to go through, the strategic planning as a team. And I think things started to move so quickly. And I remember at that time, and Miranda, you'll know this too. We were calling, I shouldn't say this on Zoom, but we called the health department. They said, yeah, we're going to meet about that next week. Do you remember that? And we were like, next week. We called the hospital. They said, oh yeah, we're going to talk about that. And I think, it's a testament to kind of our organization that, we were so far ahead of the game as far as PPE and, reviewing every cleaning product that we use in our building and testing it for effectiveness against, it was coronavirus back then. I think our team has done an extraordinary job staying on that path and keeping up as things change so quickly. I mean, I felt like every week we had, or every other day almost there for a few months, it was another thing and another thing, and now do this as everyone started to figure out what was happening. So, hats off to Miranda and our entire clinical team. I truly couldn't be more proud. So
Thank you. Can I just say, I didn't think that our CEO was crazy. As the person responsible for our disaster preparedness for our communities, I was right on board. I'm a self-proclaimed germaphobe, and so infection control is always at the top of my list, and personally and professionally. And they laughed then, but they're not laughing now that we've kept COVID out of our buildings for 10 months, for the most part. And, we received kudos for starting early and beginning our planning early. We also received criticisms because we did things, before other people, and we had to, limit our communities to essential personnel. And, we chose to have our staff wear the KN95 masks, where most people were wearing just surgical masks. And so, I feel like all of those measures that we took did, successfully keep COVID out and keep our residents safe. So sorry, I won't blab on with that.
Perfect. One thing I think this group needs to hear about is innovation. And I want you to talk about, the geek in me finds it very exciting because I never heard of this before. But I know our company is committed now to cold air plasma generators.
Yeah.
Talk about why you're getting those and what that benefit is to those.
Yes. Well, the cold air plasma generator, it attaches to our HVAC systems, and it essentially cleans the air with ions to keep it simple. So it's just something that is an extra expense, and a lot of places are not doing that, but we feel it's important to do. So
we were
Awesome.
able to we were able to get a grant for that. So we are going to be installing those at all 3 of our campuses, which is really exciting. So
Miranda, as far as communication, if I move my mom in, what can I expect, or what has happened as far as communication with the families on behalf of each community?
Well, myself as a leader and also, someone who is a family member of a senior, I felt, and the organization feels, that it's very important to be transparent. And, at times, we were giving too much information, and that, we wanted everyone to know that we were on top of it, what was going on, the good, the bad, everything. And so we actually have a communication department, and I call it a department because the wonderful Danielle and Miranda, and we just started, gathering databases and just getting all of the family members' emails and just keeping everyone on board. We established hotlines, and we just really made it a number one priority, not only to keep people safe, but to keep people connected. We wanted our family members to feel confident in our abilities and how we were protecting people.
Sure.
We've invested in equipment, iPads, things of that nature. We're just assisting our residents to do different, Zoom calls and things of that nature, things like that.
Sure. I'll share with all of you. I mentioned to Miranda this morning when we were talking about those examples, and Katie Crank is our director of resident services at Westover, and she shared with me she has a standing Zoom call with one particular family in assisted living every, let's say, Thursday at 3 o'clock. She said to me, Shelly, I feel like a part of the family. There's 12 people on this Zoom call, and I go every week and we all just chat. But it's funny, and I say that kind of silly, but it is also very true that if we become even deeper in the connection with our families, because a lot of families are not coming in. They can come to the windows, or they can call on the cell phone, but you are using us, as you should, to be that person. We are your hands, we are your mouths, we're helping connect those families. So I can tell you firsthand that our team feels that way. Our team genuinely is doing things out of the box, as many different ways they can to stay connected.
Mhm.
Do you want to talk about programs and old school activities? How are the residents, if I move my mom in,
Yeah.
what activities am I going to do?
Are we moving into what's on the horizon for the future?
No, we're talking about right now. If I move in tomorrow, what are the connectivity for engagement for activities?
Well, we are, like I said, we are cautious. However, we know that human interaction is what we all thrive on, what we all need. And so we have actually restructured our programming and lifestyle department to, enhance that. And so we've been doing one-on-one activities, just trying to really engage all of our residents who, can't go out into the community and visit with people and do the things that they used to do. And we've enhanced our technology. We're doing streamings of exercise classes and different things of that nature.
Bible studies.
Yes.
If you're watching and you don't know us, like some of you do, we actually have an internal channel that you'll see yoga, Bible study. There are different programming through technology happening both through independent living and assisted living.
And we've gotten very creative with maintaining social distance, doing things from like doorways, if you will. I know that sounds silly, but it makes a huge difference when you can see someone and be able to just see the body language and just those types of things and be in the same room. So we're really trying to be creative with things of that nature, with different bingos or different trivias and things like that.
For sure. And again, if I were a daughter, I will tell you firsthand, I'm in the building every day still for months. This team takes it to heart, the responsibility. If it just means sitting with someone, we have watched a caregiver go in and somebody says, I'm just lonely today. I just miss my family. Let's call them. Let's get connected. So they wear a lot of hats. They're not just bringing a meal or making a bed. I would say they are their sunshine every day, every team member here. So And we feel that great, huge responsibility to be that for them. Okay. Next slide.
Mhm.
So I know a lot of you on this call want to know, how do we get back to the new normal? How do we adapt? What is our process? And I know Miranda wants to talk about this in kind of two sections, all things vaccination. So they are underway, and I kind of want her to talk about how many got vaccinated, both employees, residents. What are you seeing about vaccination? So I'll just let you talk in general about our vaccination process.
Sure. Well, we obviously are very excited about our vaccinations because that is one step closer to resuming normal life. Over 96% of our residents in the main buildings have received the vaccinations, and they will receive their second shot, which is the final shot, this weekend. So I'll be here on Sunday with our team members, and we will be vaccinating the rest of our residents for the final time. So we are very excited. I'm sure you've heard in the media that 40% of healthcare employees or healthcare workers only 40% chose to be vaccinated. And so we've really been, I was kind of a guinea pig. I was one of the first. So I've been trying to just reach everyone and just share that, see, I'm semi-normal. I haven't been affected by the vaccine, just to try to ease some of those fears. Over 50% of our employees will complete their second shot again this weekend, and more will begin their first shot. So it takes approximately 3 weeks to take effect. And so that is when we have chosen to start reopening some things, and we're doing it in phases. It has to be done slowly because as we spoke about before, if it's not done slowly and correctly, and we would have one positive case, we would have to kind of scale back, and that would not work with what we want to do and the lifestyle we want our residents to lead. So, our phase one, we're going to be working on, family reunification, indoor visitations, outdoor visitations, as the weather warms, small group activities, reopening our dining rooms, the beauty salons. I mean, we all know how important it is to get your hair done just so you can feel good. And that's been one of our major requests. So we chose to vaccinate our beauticians, and they were more than willing to. So we're going to be doing that. Reopening our dining rooms for the culinary experience, and our Elements Wellness Centers, which includes the pool. So we're really trying to do everything slowly, but yet swiftly. And I know that kind of contradicts each other, but that's,
Well, there's a sense of urgency on everyone's behalf, on families, on people that live here, but that marries with safety, which drives, I know, your thinking.
Mm-hmm. Yep.
So again, that write it down moment, everybody. Phase one, 3 weeks after this Sunday, is that about approximately when you think the internal side of phase one inside this building,
Yep.
for the listeners, is when we will be able to start that up?
Day after Valentine's Day.
There you have it. Write that down.
Already planning. Yep.
But I do want to set the expectation that that it will be very similar to where we were with visits the last time. So we won't be able to. I know there are some independent residents on this call. We will still not have open access to our main building for residents or family members. For family members, it will look like scheduled visits, similar to what we were doing this summer when we were allowed to. And then based on how things transpire, we'll continue to work towards easing more restrictions as we go.
Yep.
So before we leave vaccinations, Miranda, I see us, the Berkeley Westover family, and I think people watching this see us as the experts. I just want to ask you, for people curious, what are the 2 vaccines, and who is doing the ones for our communities?
Sure. The two vaccines are Moderna and the Pfizer. And we have been vaccinating with the Pfizer because that's what the government has allotted us. And they have hired, CVS Pharmacy or Walgreens Pharmacy to come in and actually control the vaccine and administer it. And so there aren't many differences. They both affect the same mechanism for your immune system. And the only difference really is that Pfizer is given in 2 doses 3 weeks apart, and the Moderna is given in 2 doses 28 days apart.
Perfect. So I know that some people have asked me, well, do you have extra on site for me? And
Yeah.
there's, I think, a thought process that thinks we have them. Do you want to talk about when they come in and when they leave and how that works?
Sure. Yes. I like to think that the vaccines are escorted to us with an armored car.
That's true.
Yeah, I kid you not. And so the government has very tight controls. They will not give it to us as a facility or us as a community. They are very stringent, and they have only designated third parties such as CVS Pharmacy to come and administer it. So what happens is, like on Sunday, we'll be here and we have the rooms all set up, and we're going to vaccinate all of our employees and all of our residents in a time frame from 11 a.m. to 5 p.m. And so we have to have a system, and they basically bring 5 pharmacists on site, and they just start administering. So, and then they leave. They take all of their doses that they may have extra, and they leave. I would love to be able to administer it to our independent residents who, are out in the homes. I mean, that would be wonderful, but they don't, that's not how they will allow us to do it.
Sure. Well, I
The
think
good thing is
clarify.
that for the independent residents, just for those of you who are curious, and I know some of you, Pat, know this, is that we were able to leverage our partnership with the city of Hamilton, and they have been working with our resident services team to help prioritize the independent living residents by age bracket on our campus and make sure that we're able to quickly get them vaccinated, working with the city of Hamilton. So.
Okay, so let's go to the next slide. This slide, we thought we would take you through just a lot, since I can't take a tour truly through the building per the governor. Danielle and the marketing team have given a link to you to let you see a sample apartment. If you're watching your screen, this is actually a 1-bedroom apartment. And I really just for a resource, if you're watching this, of course, it's called The Benefits of Assisted Living and Why Now. I hope the first 20 minutes you've listened that why now is because we are the experts at keeping your family safe and you can be family again. But the benefits, I really want to kind of brag a little bit. This is the Westover Assisted Living. I love them both like 2 different kids. If you know me, I say that every day, 20 times. Berkeley is beautiful. Westover is like a house. And we're going to go right in the door of an assisted living 1-bedroom apartment. And I'll let her just move around and kind of show you. This is a sample apartment. You can see the size, not because I work here, but because I have experience in our industry. These are some of the largest apartments in Butler County. These square footage wise are significant to have these options. Berkeley also has 1-bedroom apartments that are this size. We call them McClellan, but this is Westover. Absolutely stunning. A mini kitchen. If I were a daughter, I would want to know. There's no stove, FYI, in assisted living per the state of Ohio regulations for safety. But in your kitchen, there's enough for your ice cream and a refrigerator and a microwave. We do want you to bring furniture from home so it feels like home. This is actually a young lady's apartment. It was just beautiful. I'll go in and show you the bedroom. What she's pointing to is a walkout patio. Now, this family put a sofa in front of that. Not all assisted living. There are many different sizes. At the end of the day, there's studios, there's apartments. When you call, like really next steps are just to give me a call and talk about that. but this is a 1-bedroom, and she's got us at the beginning just going into a separate bedroom. This is the master suite. The master suite is again significant in size. That's a queen. It will hold a king. If you're looking at us for the first time, this room has a chest, a dresser, a bed, and a beautiful chair. It is almost as big as the living room. So I just can't say enough about not just the care in apartment life and assisted living, but it's a beautiful apartment that we want to feel like home. Behind the headboards, and we're going to go in the bathroom, and behind the headboards and the bathrooms are what we call crisis cords. And a crisis cord is a button that can either be in the bathrooms or around their necks. And when they need assistance in assisted living, remember, this is a write it down moment. Assisted living is not total care. Assisted living means some support. So let's say, you need something, you're going to hit that button. All of these are handicap accessible. All of them are ADA compliant, meaning high 17-inch toilets. We'll go to this shower. You'll see grab bars as you do near the commode there. Oh,
Sorry, I'm trying not to make everyone motion sick.
yeah.
There we
And
go.
for a video, it's just a nice way. This is a very low, you can see that's just a walk-in shower. Grab bars, if that shower curtain were open, that's what you would see. So this is, I'm proud to say, a beautiful assisted living apartment. That's what it looks like. So I will kind of wrap up the assisted living part. You've seen an apartment. We've talked about the true benefits, both from a safety protocol and from, to be honest, just that socialization, that letting families be those caregivers again. I will say, the title of this Zoom is Why Now? Why in the world would I do it now? I think I said at the beginning, life is meant to be lived together, and the staff at Berkeley and Westover become your family, and our team partnering with us now makes a lot of sense from a safety clinical side. We also have, for the first time in my time here, we are allowing people to pre-reserve apartments. If you know of someone, meaning you can call me and reserve an apartment and make those arrangements. And we're really allowing significant time before you move in. I believe it's April 1st. So if you want to earmark something beautiful for someone, but you're not quite ready next week, we are working with you. I'm your guide to all things assisted living. Move-in support. Yes, we do. Me and the team, meaning a lot of different hands, help decorate and arrange those apartments. We will help you with movers if you need it. Every family is different. I'm working with one family. He said to me the other day, he said, "Oh, I got a whole tribe that's going to help me move in." But I have others that need my help, that need me to contact a Gibson Movers or whoever that might be. So I am your resource for that. Move in. The 2-second commercial is we are giving a moving credit right now of $500. I've never done that before. I'm going to sponsor that as our gift to you for a moving expense. I will tell you options. The best thing is I can refer you to our website. All of our floor plans, if you're down and dirty interested, the floor plans and price guides are on our website. Making a plan, what does that look like? I've been thinking about assisted living. I don't know what, and most people do not. Most people don't know what to do. It starts with a phone call. I can't tell you how many people say, "I am not ready. You're a nice lady, but I need to talk about this." Let's just talk about it. We can talk through a wait list for you that says, I appreciate Berkeley and Westover, but my dad's not ready. Happens all the time. Make that call me up, and I can talk to you about what that looks like. I'll tell you some questions that have come in. Some of you pre-populated questions. One of them was, I'm not ready to move in now. What are my options for securing a space in the future? So we do, as a CCRC, have an application process. You fill out an application, you will mail us a check, and we will put it on the wait list. And these applications have a line that say, I'm not ready till 2022, I think. Or my mom lives in Florida and she wants to spend one more year there. Happens all the time. Yes, you can secure a spot with us. And being part of our waitlist program, you know, it's exciting because like these new Zoom calls and different events throughout the year that I sponsor, whether it's an open house, whether it's a lunch and learn, a certain topic, we're going to do more of these to come. And I know I talk too much, but I just am excited that as a resource for both residents, families, and people that have never met us before, that you see these Zoom calls as that. We are a resource for you. We care about you. But waitlist, back to the waitlist program, I can help you get on that and how that works. Okay, that's our official slide program. That is my email. And I'll be honest, everybody, if I'm with a family, I love email. Send me an email and say, I heard about you. This happens all the time. My friend talked to you. Just send me an email and we can get you started. Our team on this call as well, we have two marketing person, Miranda Stout, Danielle Webb. They are just, we live and die by everything they do. They put together all the slides. Amy Lugers is brand new, actually like 10 days, starting in our sales office. And this has not been announced formally, but she is starting to learn a lot about what we're doing. So she's also a resource for all of you. She's not new to our company. She also is helping resident services, but her title is our sales administrative assistant right now.
I'm going to chime in real quickly because we have some questions coming in the chat.
Yeah, let's do them.
And as we have everyone muted, for those of you who joined us a little later, if you would like to use the chat feature to ask a question, I'm kind of moderating that, and we'll make sure we roll through and respond to your questions here as we wrap up. Barbara has a question, which is a great question because we did talk about 3 communities. So you're familiar with Berkeley Square and Westover. Our third facility is actually called Jamestown. It is almost right across the street from Westover. And Jamestown is a short-term post-acute care facility. So we have 42 private rooms there and a 5,000 square foot therapy gym. And it is typically, and Miranda can speak to this, the average stay is about 11 days. Is that correct?
Yes.
7 to 11 days. So it's a transitional when you're ready to leave the hospital, but you're not quite ready to go home. You can stay there, do your therapy, build your confidence, build your strength, and get you ready to return back to home. We also have skilled nursing rehab at Berkeley Square and Westover, but a smaller amount. And most of the time, the people who are doing their rehab in those facilities are residents on our campus, so that they can be close to their friends and their loved ones while they do their rehab.
Great question.
I am actively monitoring the chat. I haven't seen any other questions, so please feel free to.
Danielle, Scott Hartford had one.
Scott Hartford has a question. Do you want to unmute and ask us, Scott?
Sure. Shelly, you mentioned something about, I forgot to ask this, and I heard you, do residents have a necklace or some type of alert button if they were to fall and they need help besides the cord on the wall? I forgot to ask that, but I heard you mentioned something like that.
Yeah, no. Great question. Yes, they do. They do have, and Miranda, you might want to speak to this. We have options, correct?
Yes, we do.
Talk about those.
We do have, pendants is what we call them. Like right now in skilled nursing, we have, an option. We have the pull cord, and then they also have pendants that is also attached to our call light system.
Yes, so to answer your question, yes, she will have the option to wear a pendant in assisted living, and she pushes the button when she needs a hand.
Mhm.
Okay, thank you.
Great question.
Anything else? Okay, Ellis, would you like to unmute and ask your question? If you could hit your red microphone, there should be a red microphone button. And
Mute.
oh, there you are. All right. That's great.
We were enrolled in the exercise program that Jonathan headed up at Westover. Is there any way this is going to be opened up again for outsiders?
Sure.
I will handle that if that's okay. And chime in, ladies. So right now we are still essential personnel only in the building, and we are focusing on getting the ease of access for the residents living inside our buildings safely. So at this time, we do not know when our elements facilities will be open to the public. But we are hoping to first and foremost start with the residents that live inside the building. And then the next phase will be our independent residents living on our campus. And then at some point in the future, we will be in a place to assess how that's going and what our next steps are with reopening that to a broader community.
Good, thank you.
Thanks. Mr. Hartford, you're on mute again.
One other question. You talked about phase one being the day after Valentine's is the hope. Is that dining room as well? Like residents going to the dining room? Is that the hope that by that time residents can go to the dining room?
Yes.
That's
Yep.
good.
But I also want to just taper that with it won't be like last year's going to the dining room. You know, there are a lot of, I think, and Miranda, you know more than me, 2 people to a table and separate spaces. And, you know, there are a lot of modifications that we have to make, even with our activities opening up, you know, doing small group activities only. 6 to 8 people at a time, you know, that reduces our ability to do more activities because we're going to be duplicating that activity over and over and again to give residents the opportunity to participate as much as possible. So yes, but I just want to set an expectation that it won't be just like it was before.
Okay.
For a while.
What is the kind of the big picture? Like, okay, short-term phase one, this happens. Where do you see it going? Like, what is the hope that so many people have the vaccine, that people are going to be able to come in and actually, like, what does it look like? And I know it's not for certain, but like, what is the hope, or what can you see down the road happening to get more back to normal?
Well, all of that,
Normal.
yeah, all of that depends on what mandates come down and what guidelines come down with from the regulators. But eventually, we want things to be how it used to be. We're hopeful that that the vaccinations will help, and that we will be able to freely come and go.
Okay, thank you.
Pat, if you would like to unmute. I see you have a hand up. You're still on mute. Do you see your microphone, your red microphone, Pat?
Here it says, okay. Am I on now? Okay.
Yeah.
Yeah, one thing I wanted to ask you is about February being the Valentine dinner month, twice a week. And
Yeah.
I signed up for that. I'm excited about that. I want to ask first, is it going to be in the coach house rooms or is it going to be in the dining rooms, the Theobald Hall rooms?
The coach
And-
house.
The coach house rooms, okay. And how are they going to come? I mean, how will they know when we're there to come out to the car to bring us in? They said we'll be escorted from the car inside. So how's that going to work? We just go park in the lot and I don't know. Somebody finds us? We
Well-
put out a white flag?
Well,
I,
there aren't many cars parked in our lots at this point.
Okay, okay.
So
Okay.
We'll have
Park in
someone out
front, park in front by the patio, Pat.
In the front, okay.
Yeah,
I mean,
and they'll take you
Oh.
directly in. But to clarify for everyone on the call, the food is not being prepared in the coach house kitchen. It's being prepared in the main kitchen and will be brought down. So there won't be any other type of dining other than what is served as part of that meal.
right. One other question though, is this because of, there must be many people interested. I don't know the numbers. And is it possible to be able to do that more than once during the month or we just get one shot at it?
we're
I think
starting,
right now they're starting with once a month just because we don't know how many people are interested. I think if reservations aren't made by later in the month, we could reassess that, Pat.
That's fine. But one on another topic, I know I've seen the prices for the living inside living there and on your website, but I can't remember. Do you also list the amount the deposit needs to be paid for each type of apartment, assisted living and so forth? Is there, I know there's a down payment we have to do. Is that listed on that site?
well, so I can answer that. She's asking, the question is about a deposit. If you already live here,
Mhm.
you are exempt from that.
Oh,
So if
okay.
the day comes, Pat, down the road that a friend of yours that lives here or yourself, when you pay an entrance fee, it's one time. So
Okay.
you have paid that. For people watching or listening that are thinking about assisted living straight in, there is an entrance fee of $5,000. And that only applies to people that are not living in our homes currently.
Okay, thank you, Shelly.
Great question.
Any other questions before we wrap up?
No, we're good.
Wonderful.
We're right at an hour and I know that we're all very honored everybody got on to hear our very first Zoom call. Stay tuned. We have another one coming.
Thank you all so much for joining us.
Thank you. Thank you.
Thank you.
Bye, everybody.